Everyone, and welcome to our June GIC meeting. I want to welcome our constituents on live stream. I am joined here by our esteemed board and our GIC staff. I'm Valerie Sullivan, and I'm thrilled to have summer be almost here in the Boston and Massachusetts area. So I'm joined here today with Vice Chair Bobby Kaplan, designee for ANF, Anna Friedman, designee for Division of Insurance, Rebecca Butler. We also have Martin Curley, Tamara Davis, Jane Edmonds, Eileen McEnany, Kristen Pepin, Jason Silva, and Anna Senenko. And we expect a few more commissioners. We'll announce them as they join. So let's get started.
Gersino Gerard.
Oh, and we just were joined by Gersino Gerard. So we've got a quorum, and I'm going to turn the meeting over to Matt to walk us through the agenda.
Thank you, Madam Chair. Welcome members of the commission, members of the public who are following along. Happy to see you all on this beautiful June day. So today we have two main items on our agenda. First, Paul Murphy, our Director of Operations, and Leslie Montero, our Communications Director, will give a report on GIC's 40th annual enrollment. They will provide an overview of the data regarding all the puts and takes of our open enrollment period and highlight the level of engagement that the data will show with our members during what was an extraordinarily busy annual enrollment period for our operations unit. And Leslie will also assist with some of the with data around our member engagement and member touch points from a communications perspective. And second, Andrew Stern, our General Counsel, will provide an overview of the GIC's statute and bylaws, which we have not reviewed as a commission in some time. And we now have several new members of the commission, so the time felt right for this. This is also in response to a request that we got from the commission earlier in the year, and we found this meeting as a time to slot that in. So that is our agenda for today. We do typically at this meeting present our out-of-pocket report, but our data analytics team will have that ready for us when we convene after the summer in September. So that is our agenda for today.
All right, great. Well, we're excited to learn about open enrollment and use of the My GIC. I always like seeing the amazing progress that we're making with our constituents moving to enrollment options. So very excited. So at this point, I'm going to ask for a motion to approve our May minutes.
So moved.
So Bobby is yes. And do I have anybody else to second?
Second.
Okay, so I have a second. So at this point, I'm going to call on Andrew to take roll call, but I'm an aye. Andrew?
All right, I couldn't get off mute. Thank you, Chair. Vice Chair Kaplan.
Aye.
Designee Friedman.
Aye.
Designee Butler.
Aye.
Commissioner Curley.
Aye.
Commissioner Davis.
Aye.
Commissioner Edmonds. I know she was having trouble with her.
Aye.
connection. Thank you. Commissioner Durand.
Aye.
Thank you. Commissioner McEnany.
Aye.
Commissioner Pepin.
Aye.
Commissioner Silva.
Yes.
Commissioner Senenko.
Aye.
Commissioner West,
Yes.
and let me just check. I believe that is everyone who is present, and it was unanimous.
All right, great. Thanks, Andrew. At this point, let's dig into the meeting and the meat of it. So I'm turning it back over to you, Matt.
Great. Thank you, Madam Chair. So for the Executive Director's report, I'm just for the sake of time, I'm not going to walk through each of the items, but we have provided you, as we always do, with the written report ahead of time. It highlights an update on some legislative matters, including activity regarding the budget and how we continue to support the cities and towns, the 11 cities and towns that are joining the GIC on the 1st of July. There's also a rundown of communications with our members around VITA and our support for our members as we transition away from coverage for GLP-1s for weight management. So I encourage commissioners to review the report at your leisure, but I'm also happy to take any questions about what we've provided to you.
I don't see any questions, Matt. Oh,
Commissioner.
Jane's got her hand up. Go ahead, Jane. You've got the floor.
Matt, I was just wondering if you are planning to give an update on the governor's working group.
Yeah, so I can give you a high-level update about the working group. We have been meeting since I think late February or early March. The group has divided itself up into 4 different subcommittees focused on let's see, workforce, administrative efficiency, payment and pricing, and the delivery of care in the right place at the right time and the right care. The group has reached sort of a midpoint of the process, and it's expected that a list of recommendations will be going to the governor within the next few weeks. This is sort of the first tranche of recommendations that will emerge from that group. And then the work will continue throughout the calendar year on a variety of other recommendations that will take a little bit more time for the group to work on. I would say the work is productive. It is collaborative. It is focused on the right things, in my view. It's focused on the real core drivers of our affordability crisis in the state. So the group, one of the rules of the group, or one of the expectations of the group, is in support of kind of candid, ongoing dialogue and collaborative dialogue, that the work of the group will remain mostly confidential. So I can't speak to any of the specific items that are being discussed there, but I can give the group, the commission, the message that it is a serious effort, and I'm an active participant in that group, as you could imagine. And, we look forward to the continued work.
Yeah, no, thanks, Matt. We know how active you are, or at least I am very well aware of the hard work that's going into your participation in the working group. I don't know, Anna Friedman, designee for ANF, is there any color that you could add, since this is something of urgency for our next, premium review?
Thank you, Chair Sullivan. I think the only thing that I would add is just to echo the executive director's, comments about the diligence and seriousness of the effort. But beyond that, I wouldn't have anything further to add.
All right. Well, I know commissioners are looking for some premium growth relief, and we're all very confident that the governor's working group may bring us that. So we are fully supportive, Matt, on that. Bobby, I see you've been patient. You have your hand up. Go ahead and take the floor.
Thank you, Valerie. I have a couple of questions. I don't know if I have a question regarding VITA. I don't know if it's a little premature for that, but I happened to notice that there was an update on GIC's website yesterday regarding VITA, and now the new FDA approved medical conditions in order to have a GLP-1 prescription approved, not by VITA, but by CVS Caremark. And so I was wondering if you had any sort of sense as to how frequently these guidelines are changing, because maybe 3 weeks ago, I looked on the FDA website and they were different. There were more conditions that were allowed for someone whose BMI is greater than 30 and who has some other medical conditions. And now there are 3 currently that are approved. And I'm curious if you have any idea how frequently these may change. And also whether anyone is taking advantage of VITA for either exercise programs or help with, manufacturers' rebates, because what I'm hearing is that the cost for employees for GLP-1s, for obesity, and some medical condition that apparently is no longer covered or no longer considered a problem under FDA, people are being charged somewhere between $300 and $1,200 a month for GLP-1s, which obviously is not affordable. It's not sustainable. It's not affordable. And I'm curious if we have an update on that. I asked that GIC's message on June 17th be posted in all of our state pages so that our members know and are well informed regarding the change. So I'm curious about that, what information you may have, and how is VITA helping people, with manufacturers' rebates or coupons or whatever, and what those amounts may be, and what people have to do to actually get a prescription when they really need it. And so I'd like to know about that. Then I have another question, but if you could speak to that first, I'd appreciate it.
Yeah, excellent set of questions, and I will hand it over to our Deputy Executive Director, Erica Shabelli, who's been quarterbacking a lot of this work for us, particularly on the communication side, and Andrew Stern to the degree that there are questions that are more in his area. Erica?
Thanks, Matt. Thanks, Commissioner. So I'll take the question about kind of what VITA is doing for folks going through manufacturers. And the answer to that is right now, nothing right now, because we're still covered until July 1st. And so the transition in those services isn't going to happen until July 1st. So we wouldn't have data on that until that time. So that's kind of an easy question to answer. Nothing at the moment, because the folks that they're working with right now are either in the process somewhere or have already been prescribed a GLP-1, and so their coverage remains through July 1. So we expect that we'll have more information from VITA after we've had some time kind of without coverage for them to report back. You also had a question around our update that came yesterday. We had initially posted a news post, and that's what you're referring to, about kind of the upcoming changes with VITA and coverage for GLP-1s. And we have a banner, an alert banner on our page, really to make it kind of a focus for folks when they're coming to the GIC's webpage. Yesterday, we updated that webpage with examples really of what is currently covered or what is currently considered a comorbid condition for the 27 BMI plus. Those, as you noted, are subject to change really at any time. And we don't have control over that. That's the FDA. And then CVS would kind of implement those in their PA process. So we wanted to make sure that our members had all of the current information, knowing that we are not the owner of that information. So we're doing our best to keep members updated. But what we've also done on that news post is say to folks, if you still have questions even after reading this, we get that. But we also don't have the expertise in that area. That's where our PBM and your provider will really be your key points for information. So have directed folks to the appropriate channels for their information. Just really wanting to make sure our members are aware. So folks will be getting a letter from CVS noting kind of their changes happening on the CVS side. We updated our news post such that when folks get that letter, our talking points or our page will match what is going on at CVS and what CVS is telling folks. So really trying to have a coordinated effort here. Because we know this is a lot of yo-yoing for our members already, and wanting to do what we can to guide them through what's going to be a transition for folks. Andrew, anything to add on the PA process and how CVS may or may not handle that?
I don't have a lot to add on that in particular. it's the criteria pretty much matches what we put up on our website. As the FDA changes things, it will get reflected in the process. I can add that the plan with VITA is that come 7/1, they will educate and support members looking to continue to receive GLP-1s through direct channels, including letting them know about appropriate manufacturer discounts and coupon programs. So we've asked them to do that, and that's already built into the work plan.
And to add to that, Andrew, is there any request that could be made to VITA to come to one of our meetings, or just give us a handout of like how many patients or how many of our members did they serve? What was the outcome? Do they have some numbers to just give us a sense of, in the short time that we provided this service to members, was there any good that came out of it, or, any insights that either VITA or CVS could share with us? Since we have had so many conversations about VITA, I'd love to see some data and discern that.
We have weekly meetings with VITA, and they report at every meeting on those kind of statistics. We could certainly forward you the most recent report.
Yeah, I mean, I'd love to see it. I don't know, Bobby.
I'd like to. I definitely. I'm sure all the commissioners would love to see it. Actually, that would be great. That would be great. Also, I think I might have mentioned it. Well, I'm not sure if I have, but what I am being told is that people who are sort of transitioning now and do have an approved comorbidity, their doctors who are writing scripts and sending them to Caremark. Caremark is not accepting any, I am told, before July 1st, directly from the provider, right? From from an employee's physician. So, and Vita's not doing it for anyone who is new to GLP-1s. And so I understand if Caremark is not going to, fill the prescription, but to refuse the prescription because people are worried that there's going to be a gap in their, in that medication and being able to receive it. So wonder if you know anything about that.
Yeah.
And
we're very sensitive to that. We've been working on how we can best smooth that process over. I don't know if it's been completely confirmed, but the most recent discussions we've had with CVS is taking the PAs in advance of 7/1, but they are pended until 7/1, so that they can be go into effect right away when the transition happens. The problem is the criteria. If there's the way the programs interact with each other, they can't take them in advance because the system will reject them. But we've gotten to the point where I think providers can submit, they won't get rejected, they'll just get pended, and then they can get acted on 7/1. I need to confirm that, but that I think was the most recent conversation I had with them, which was this week.
Yeah,
Thank
you raised it's a really good set of questions, Bobby, and those are precisely the kinds of issues that our team has been working very diligently to sort out so that we can make this transition as, I don't want to even say as smooth as possible, but as just to manage
Painless,
it as responsibly as we can. We always knew this transition was going to be bumpy and difficult. And I just want to underscore what our Deputy Executive Director said earlier. This is, it's a difficult transition for our members. It's very difficult. It's living up to our expectations of it being difficult.
I just want to say I appreciate everything you're doing, which is why I was really pleased to see that message posted yesterday. And just to confirm, you're going to post like whatever CVS is going to communicate to, employees, right? That will be there as well. And then, I'll make sure that we post it for our members too, because I want to make sure everyone, is notified and has the latest information. And I appreciate all the work that, you and Andrew and Erica have done on this. So yeah, so any updates, anything at all, is greatly appreciated. And I have another unrelated question. Well, sort of about the PBM procurement and when the RFP is going to be, posted. Like, is there any update on that? Or am I premature at asking?
It's never premature to ask a question. It may be premature for me to answer it fully. But I can tell you that the procurement team is very hard at work to develop the documents for the RFP and develop our strategy working with Mercer. That work is going very well. It's in many respects sort of an all hands on deck effort for us, knowing how important it is for us to get this right. I think Andrew, I would defer to Andrew as to the timing of the posting of the RFR, but my recollection is before the end of the summer.
The current anticipated posting date is July 8th.
Oh, okay.
Oh, great.
And,
Great.
and Andrew, is there an RFR and then an RFP, or is it the same? I'm
It's the
just
same thing.
nomenclature.
Just two different
Okay.
terms for the same thing.
Okay. All right. Bobby, is that
Yes.
all of your questions that you had?
For now, yes.
Okay,
Thank you,
yes.
Valerie.
For now,
Yes,
yes. Thank you for clarifying. All right, Eileen, I see your hand up, and then I know, Matt, you're eager to move on, and we will, but Eileen, you have the floor.
Thank you. So I wanted to return to the discussion and the update for the Healthcare Affordability Working Group. Matt, I didn't know if you would be raising it later in the meeting, and I can certainly hold my comment until then. But if that was the update, I did just want to suggest, first of all, it was great to hear that they're being diligent and very collaborative. But I think Michael Baylett's presentation last meeting was really informative, and I think it would be helpful to the full working group, but particularly to the payment subcommittee. So I'm just wondering if we can send that PowerPoint slide deck to them for their information.
Yeah, we're certainly happy to do that. If that's the desire of the commission, we're certainly happy to do that.
I mean, I do think it's worthwhile to just put that information on the table. We've talked many times in past meetings about the need for systemic change, and I do think that's what Michael Baylett's presentation was all about. So I think it would be great for them to have that information for their consideration.
Yeah, I'm happy to do that as soon as the meeting wraps up.
Yeah, Eileen, that's a great suggestion. And Matt, I think I speak for many of the commissioners that I talked to after the meeting. We really enjoyed the fact-based presentation that Michael Bailiff made. And, we are confident that, getting it to the working group, it sounds like could be, just more information that's data oriented to help that working group make a decision that might be tough, but that'll be good for holistically healthcare cost containment in Massachusetts, at least for the GIC, which is what we're all here advocating for. All right, those are all of our questions on the first agenda item. Matt, we can keep moving.
Great. Thank you, Madam Chair. We can go to the next slide. I believe we roll now into our annual enrollment report. As I noted earlier, this is the 40th annual enrollment, so we've hit an important milestone. The annual enrollment this year ran from April 1st through May 1st. And as the commission is aware, we onboarded 11 municipalities, and they've all participated in the annual enrollment and had their opportunity to make elections for benefit coverage for July 1st. This is the largest entry of municipal entities to the GIC since coverage through the GIC was made as an option. We expect that to continue for the foreseeable future. So Paul Murphy, our Director of Operations, as I noted, will present data on our member engagements and their elections, and then Leslie will share some information on our communications effort leading up to annual enrollment. I'm really excited for you to see all the data, and one of the takeaways I'll give you as kind of a spoiler alert is that it being an extraordinarily busy year, a year of a high level of engagement of our members, and that means a tremendous amount of work being done mostly by our operations team to be responsive, and I think it just reinforces the level of dedication that our small but mighty team does to serve our members during what has been a very busy year. So with that, I'm happy to hand it over to our esteemed colleague, Paul Murphy.
Thank you, Matt. Good morning, commissioners. As Matt said, I'll be presenting this year's results from annual enrollment. So if you can go to the next slide. On this slide, we like to represent every year the number of registrations through the self-service member portal, My GIC link. We launched it in 2021, and you can see from 2021 up through half of 2026, we have about 125,934 members using the My GIC link to manage their benefits. So each year, the registrations continue to grow. We advertise our My GIC link to every communication that we launch, asking people to register or check it out. And it continues to be successful, and the registrations continue to grow every year. One note I like to point out here is at the top left-hand side of the chart, 73.4%. This is the number of new hires coming into the Commonwealth every single month, and that is the percentage of new hires that use the My GIC link to register for their benefits. So it's a really good number, and we're happy that members coming on board utilize the My GIC link to elect their benefits as a new hire. You can go to the next slide. So what this slide demonstrates is GIC has multiple entities, as you know, coming in to the GIC. We have over 236 payroll systems that we have to administer throughout the Commonwealth. We break it down into three categories: online, municipal, and offline. So what this demonstrates is the 125,000 registered members, where they fall by agency type. So for the online, what that means is those agencies that participate in the state PeopleSoft payroll system. GIC has a large interface to that payroll system, and it handles approximately 90,000 members. So we refer to that as our online agency. Municipal, pretty self-explanatory. Each municipality maintains their own payroll system. And then for all of the quasi-agencies, all of the retirement boards, the state retirement system, the teachers' retirement system, we refer to those agencies as offline because each one of those entities has their own payroll system. So we interact with many payroll systems to get the deductions from employees' paychecks, but this will demonstrate by category: active employees, retired employees, surviving spouses, where they fall in registering for the My GIC link. The biggest entity being the online payroll system. Many people have registered and utilized the My GIC link for their benefits. Further right, you'll see the orange, the 22,000. That represents our retiree population, the retirement board system, teachers retirement board, and state retirement system. So there's that blip that even some of our retirees are utilizing the My GIC link benefit. We have about a little over 1,100 entities total between the online, municipal, and offline agencies that we administer benefits for, but we thought we'd give you a breakout of the registrations by member type and agency type. Next slide. So what this slide represents is the 4 weeks of the annual enrollment, April 1st to May 1st. The number of cases that we received during that time that we needed to process. A case is referred to, in simple terms, an application. So when a member completes an application, whether it's through the portal, off our website, completes a form, or sends us a form through email, we refer to it as a case. And that's how our CRM system, Salesforce, administers the benefits. So we treat each one as an individual case. So we're breaking out the type of cases. You'll see at the bottom in blue, DataBank. DataBank is our scanning vendor. So members who choose to download an application and complete it in pen, sign it, and mail it to GIC, DataBank is our scanning vendor. So they administer all of our paper applications that come in from members through the mail. Email, pretty self-explanatory. People that send us enrollment applications through email. GIC forms, that is a new way in which members can submit forms to the GIC. We implemented that last December. As you may recall, at the December meeting, we gave you information that the GIC eliminated the DocuSign system in which members could submit electronic applications through DocuSign. It was a savings of over $300,000, and at that time, we felt it would be a good idea to let's push the member portal. So as you can see, the numbers in green, those represent the number of changes in cases and applications that members submitted to the GIC during the annual enrollment period. And nothing surprising, the last week of annual enrollment, you can see that we got over 9,000 applications coming into the GIC. Next slide. So what this represents is a historical snapshot over the years from 2022, which was the first annual enrollment in the member benefit portal, all the way up to 2026. Again, representing the ways in which members can submit the data bank scanning. We did have the DocuSign for the last 4 years. You'll see that in orange, email in red, and then the portal in green. So you can see that the portal, the green bars, continue to grow, and some of the other ways in which members submit applications continues to decrease. I will note that in 2023, that blip of 30,000 comes about with, that was our last health plan procurement. As some of you know, that we had a procurement in 2023 in which we offered some new plan offerings. We changed some of the names of some of the health plans, and we did a default back then, and we encourage people to go in, look at the portal, and look at their member benefits with GIC. So we did have a lot of information coming in 2023 because of that procurement. But other than that, you can see the steady progression of the My GIC link, people using the portal, 27,127 coming in this year. Next slide. So this slide is colorful, for lack of a better word. It represents a lot of the different changes. So basically what it is, you treat it like a clock. You look at the top, you see the circle, number 15, and that is the types of changes you'll see listed on the right-hand side. So it starts at the top, 15, those are date of birth changes. And going clockwise, this is the number of changes that GIC received through the member portal that members went into the My GIC link and updated all of their personal information. So in the past, before the launch of the portal, GIC would have to handle every one of these transactions through paper and process it in our data entry unit. So members have really taken on the My GIC link and have given us all of the updates for their personal information. Just some key numbers down below. You'll look at the blue, the pink, and the light pink numbers. Those represent address changes. We collect home address, we collect mailing address, and members have gone in and updated their information. That saves a huge time saver for GIC, that we don't have to process these changes by hand anymore. This is the changes that come in through the portal. So 42,918 is a significant change. We usually advertise the My GIC link starting with the listening sessions every January, and we ask members to go into the portal, look at their information, update any personal information so that they have all the correct information before the start of annual enrollment. So this runs from January through May, in which members went in and updated over 42,000 personal data items in the portal. Next slide. So what this slide represents, and it only represents changes coming into the My GIC link portal. We'll have other numbers on applications and paper forms coming into GIC, but we wanted to demonstrate the number of changes coming in through the My GIC link for annual enrollment. You can see at the top left-hand side that we received over 15,358 member changes in the portal. Those changes represent coverage changes, individual to family, family to individual, withdrawal, cancellations, buyout, adding dependents, taking off dependents, etc. So we had over 15,000 changes come through the portal. Also within the portal, you'll see the number of members, the 2779. This is the number of members that actually went in and switched plans using the portal during annual enrollment. And all of these changes was an enormous time saver for staff. We did not have to go in and process these applications. This all came into our eligibility system through the MyGIC link portal. Big winners using the portal, you can see the orange was Harvard Pilgrim Explorer at 2,954, and you can see on the far right-hand side, plus 3,219. So that represents just the portal changes, but this portal continues to be successful for GIC. If you can go into the next slide. So on this slide here, as Matt mentioned, this was the first time since 2009 that GIC took in 11 municipal entities. Some of the large entities we took in this year, City of Malden, all the way down to a small entity, the town of Leyden. So it was 11. It was a lot of work, a lot of communication, a lot of effort from all GIC staff to get these 11 municipalities into the GIC. So we thought we'd give you a snapshot of the number of members. We don't have dependents, but this is the number of members that came into the GIC from those 11 municipalities. We'll have more information on dependents and total membership later on, but we wanted to demonstrate the number of people coming in, 4,244 members. But the best thing here is that 3,401 of those members utilized my GIC link to elect their benefits coming in from those municipalities. Some of the big winners here, we broke it out by health plan across all 11 municipalities. On the active side, you'll see Harvard Explorer, Harvard Quality, and the WellPoint Plus plan. On the retiree side, you see the Harvard Medicare Enhance and the WellPoint Medicare Extension. But we thought it would be good to demonstrate where the people fell within these 11 municipalities and the number of people that actually use the portal to elect the benefits. Next slide. So this slide represents phone calls. So usually immediately after the launch of the listening sessions in January, we like to track the number of phone calls that come in during that time from January to May. So during that time, GIC staff answered 48,216 phone calls in the 5-month period. And that small bracket in red is the annual enrollment period from April 1st to May 1st. And you can see during those particular 4 weeks, GIC staff answered over 15,000 phone calls. To put it in perspective, we asked our health plans to give us total customer service phone calls coming in by health plan, and across all of our health plans for the month of April, our health plan customer service reps answered 11,649 calls. So we answered many more phone calls from our members with a much smaller staff and operations. 15,000 calls is no easy task, but it is a good number. And I appreciate the staff putting up and answering all of those phone calls during annual enrollment. The next slide. This represents phone call disposition. So after every phone call, the staff get to quantify what the phone calls were about. So we try to track so we can see what the membership is asking for. You can see here that the top 3, starting at the top, the benefit questions on health plans. People ask about, copays, deductibles, etc. What plan might be good for them based on where they live. Next one down, eligibility for GIC benefits, 5,962. Many people ask about enrollment, time frame, deadlines, qualifying events, adding dependents, signing up for life insurance, signing up for long-term disability, signing up for dental. So many of those phone calls fall in that bucket of eligibility. And verification of benefits at the bottom, 7,603, is usually a member that will call in and ask, what plan am I enrolled in? What do I have for benefits? Who's covered under my plan? Basically just verifying what they have during annual enrollment, and so they can make any elections they want or changes for the member portal. But kudos to staff for the number of phone calls in that 5-month period. Next slide. So this slide represents member chats. When we launched the portal back in 2021, there is a feature in which you can chat with GIC staff. So that chat feature, introduced in 2021, every year, as you can see, this mimics the phone system. We track these from the launch of the listening sessions through annual enrollment. So GIC staff received 4,219 chats from members in the portal during that time. And the little red bar down below, April 1st to May 1st, the chats, we received 1,773 chats from members during that time. Great communication tool that we introduced with the portal, and we have dedicated staff in each unit to handle the member chats coming in through the portal. Next slide. No surprise here. You'll see the benefit, the health plan questions, eligibility for benefits, and the verification of GIC benefits. It mimics the phone system, same questions we get through the chats come in from members during that time. Next slide. So what we like to demonstrate here is a summary of the plan transfers. As you saw earlier, we had about 2,700 people change plans using the portal. But what this slide demonstrates is the number of changes in plan transfers. Now, this is just members that change from one plan to another during open enrollment. So you'll see in the far right-hand bottom, 3,558 people change plans during annual enrollment. I apologize, it's a little small on the print, but you can see from the top left to right. So what you do is you look at the left-hand side, the Harvard Pilgrim Access America, and you read across from left to right. So if you read across, you'll see that 38 people transferred in. So from left to right across the top, those are the numbers of people that transferred into that plan during annual enrollment. And each number represents, across the top, 9 transferred out of Harvard Pilgrim Explorer, Harvard Pilgrim Quality 3, Health New England 4, MGB 3, etc., all the way across. So we track the transfers into the plan, 38. And if you look at the top of the chart and read down on the Harvard Pilgrim Access America, you can see that 27 people transferred out of that plan. And those numbers also represent the plans that they transferred out of. So a lot of numbers, but you can take this and read it at any time, but you'll be able to see the transfers in, the transfers out, left to right across the top are the transfers in, bottom, top to bottom are the transfers out. But in total, 3,558 members transferred their plans during annual enrollment. If you could go to the next slide. So what this slide represents is we like to give the net gain across all of the plans. So on the left-hand side in black, you'll see the numbers. So during annual enrollment, we track the new insureds coming in by plan. You can see, Harvard Pilgrim Access America 56, Explorer New hires, 1,539. Next column are transfers too. So if you recall from the last slide at the bottom, you see the 3,558 plan transfers. So this number represents the transfers into the plan, the new hires that come in during the annual enrollment for coverage July 1st, and then a total column. The numbers in red represent people that withdraw from coverage, terminate state service, etc. during annual enrollment, and then the transfers out, the same number at the bottom, the 3,558. Overall total, you'll look across that the net gain by health plan, you can see the number. You'll see that the plan like the Harvard Medicare Enhanced, 1888, and the WellPoint Medicare Extension are the biggest popular plans from our members and the net gain. For the active side, you can see the Plus, Community Choice, Harvard Pilgrim Explorer continue to be the popular choices from the members. So that is the net gain or loss by health plan. Next slide. So as I mentioned earlier, with the 11 municipalities coming into the GIC, I'm looking at my slide here, and I apologize. It's getting very dark here. And so, not that I'm in the witness protection program, but it is, I do exist here, but so what this slide represents is the health insurance enrollment. So we like to give a snapshot of what this looks like after annual enrollment. So this represents all of the state, all of the municipal, it represents members, as well as all of the dependents by health plan. So you can see we have 432,000 members in just health insurance only. To put this in perspective, last year, the same snapshot, we were at 423,000. So we've had a gain of over 9,500 people during this year's annual enrollment, both members and dependents. Top plans you'll see on the active side, Harvard Pilgrim Explorer, the WellPoint Plus, and on the retiree side, the WellPoint Extension and the Medicare Enhanced. But, increase membership independence, mostly due to the 11 municipalities coming into the GIC, where we've picked up over 9,500 members and dependents. The next slide. So every year we like to give a snapshot of our ancillary benefits, the long-term disability, the optional life insurance, the active dental vision plan, and our retiree dental plan. So this represents the last 4 years. You can see the fluctuation in total enrollment, but you'll see at the bottom, the blue represents the active dental vision plan. That has steadily increased, not by a lot, but it continues to go up. Optional life and LTD fluctuate every year. That is based on people coming in, new hires, people canceling coverage, people retiring, or signing up later on. So that number can fluctuate, but it has been pretty steady over the last 4 years. The green represents the retiree dental plan. This plan continues to be a popular plan among our retirees, and you can see the growth from 2021 all the way to 2026, where we are at 49,127 retirees electing that plan. So from last year to this year, it's about 2,100 new retirees electing the retiree dental plan. So that plan continues to grow. It's a great benefit to the retirees, but we wanted to give you a snapshot of where the membership falls and the numbers by product. Other than health insurance, this is where we want to show about the long-term disability and the other benefits. Next slide. This is just a quick reference, buyout applications. Buyout is a product we offer every annual enrollment, and we also have a buyout in the fall. Buyout allows a member to cancel their GIC coverage during annual enrollment or during the fall buyout period and receive compensation for 12 months for 25% of the full cost premium. So this year during the annual enrollment, we had 147 members elect the buyout. So they continue to start receiving a check for the next 12 months starting in August. And we'll have another one in the fall, so for people that want to buy out for January. So 147 applications come through the portal. FSA, as you know, that the commission changed from task to Ameriflex during this year's annual enrollment. So we wanted to give you the enrollment numbers. So for the healthcare spending, 15,674 members joined the healthcare spending with total plan elections in the dollar amount of over 33 million. And on the dependent care, you see that 2,289 members elected the dependent care. So compared to last year, we had an increase on the HCSA. We had 15,584, so a little over 100 and something members increase on the healthcare spending. And then on the dependent care, we have about the difference of 6 less than we did last year. So overall, the transition went well with the new vendor, and the numbers continue to stay constant and grow. So there was no loss with those benefits, just continues to grow. But in perspective, the dollar amounts that members are electing during that time also have increased dramatically. 31 million last year compared to 33 million in dollar elections. And on the dependent care side, we had 8 million last year, and this year we have members electing upwards of $11 million. So I think that's the last slide before I can turn it over to Leslie for her presentation on communication. Unless you have any questions, or we can take it at the end.
I don't see any questions, so let's take them at the end.
Okay.
Oh, all right.
Thank you. Bobby, your hand snuck up just as I was saying that, but are you okay waiting, or do you want?
Okay. I'm okay waiting. I
Okay.
just wanted to commend Paul and his team because the data is like terrific. We really appreciate it. I just wanted to thank him. I know I could have waited, but I had to do it right now. So thank you, Paul, for astounding work, really, you and your team. It's great. Thank you again.
Awesome. All right, it's well deserved. So Paul, you can turn it over to Leslie now. That's great.
All right, good morning, commissioners. As in previous years, we continue to refine and streamline our annual enrollment planning and processes to improve efficiency and enhance our member experience. Our annual enrollment communications follow the same approach and continue to provide members with helpful resources like the virtual benefit fairs, guidance on how to compare health plan options, as well as updated benefit guides and other helpful enrollment materials. So this slide provides an overview of annual enrollment communications, and it identifies which materials included information about My GIC Link, our member benefits portal. This year in particular, our communications placed an emphasis on increasing awareness and usage of the portal by incorporating My GIC Link messaging into existing communications, including our website on pages and news posts where it had not been featured in previous years. As a result, which Paul also talked about earlier, we saw an increase of roughly 3,000 more portal registrations from January through May compared to last year. Despite a significant increase in fuel prices during April and higher distribution costs associated with delivering printed benefit guides to agencies across the Commonwealth, we were able to maintain costs comparable to previous years. And this was achieved by completing the benefit guide design work in-house, resulting in meaningful cost savings that helped offset increased printing and delivery expenses. Now on the next slide, we can see GIC website stats during this year's annual enrollment period in comparison to previous years. As expected, the most relevant annual enrollment pages had similar views as last year, with the exception of the benefit guides page. This was surprising to us, given how much attention our previously proposed plan design changes received. With that said, I noticed that this year we had 20,000 more views on the benefit guides page in March than in previous years. When the benefit guides are able to be designed in-house, they're published on our website and accessible to members earlier, which might explain the gap between last year and this year's number of views of the page during annual enrollment, which started April, versus the views in March. Also worth noting, 2024 had a higher member engagement than most years, as it was the year after our procurement year. And this was also the period where Unicare changed its name to WellPoint. And now on the next slide, we can see GIC social media engagement stats during this year's annual enrollment period. GIC's X account continues to be a good source for partnering with our carriers to spread information, for example, to inform members about the ongoing changes in the GLP-1 landscape. And we saw similar engagement as in previous years. GIC's LinkedIn continues to reach thousands of members who we can safely assume are mostly employees on the platform. And we have continued to leverage this channel to lead them to our commission meeting live streams and our website, especially our annual enrollment focused news post. And finally, our YouTube channel continues to grow in subscribers and engagement during annual enrollment. And all these numbers are very comparable to previous years. And with all our channels, we consistently utilize our partnerships with various agencies like HRD, our Human Resources Division, and MSRB, the Massachusetts State Retirement Board, to name a couple, in order to reach as many members as we can. Overall, this year's annual enrollment communications efforts were successful in maintaining strong member engagement while increasing awareness and adoption of the portal. And we are continuously evaluating new opportunities to reach members where they are, improve their experience, and ensure that they have the information that they need to make informed benefit decisions. Thank you, and happy to take any questions, as I'm sure is Paul.
Yeah, thanks, Leslie. I'm going to turn it over to Matt to make a few comments, and then I'll open the floor up for questions.
Thank you, Madam Chair. Just want to reflect a little bit on some of the trends that you're seeing here over the last few years. So each year, every year, we see increased engagement with us from our members. We have more municipalities coming on, which is a tremendous amount of work to support them from our comm staff, from government affairs staff, from the operations team, from the IT team to set up systems. We have more members coming in every year. More pressure also, and an increasing need to support our members as we consider changes to deal with the rising costs. The portal, as Paul noted at the outset of his presentation, has been an enormous asset for us to be able to say that there were more than 40,000 transactions that our members were able to conduct self-service through the portal and not have to be handled individually by staff as they had prior. That's been, it's hard to imagine how we have continued to do what we do without that. But as you can see from the phone call volume, the chat volume, the use of the portal does not mean that our workload is decreasing. In fact, it substantially increases every year. So we have rising need to support our members. We have rising pressure on our staff. We have enormously dedicated staff. We ask more from each of them every year. And I do frankly worry that we risk burning some of them out. If we want to have the capability of continuing to serve our members at the level that they deserve, we will need to address this because we have sort of two trend lines. We have the trend lines of increased need from our members, and we have essentially level staff over this entire period. And we're going to need to address this in some form. Again, if we're going to continue to serve our members in the way that they deserve to be treated and served. So when we do annual enrollment, this is always an enterprise-wide effort. So we rightly acknowledge the extraordinary dedication of our operations team, but I don't want to miss the opportunity to thank and acknowledge others who exhibit the same level of dedication. Our IT team continues to knock it out of the park. The level of work that's needed, even if you only look at the number of municipalities that we brought on, and we're talking 9 staff on the IT side through our A&F IT colleagues. The legal team, we got 4 people on the legal team. We've got a long list of contract amendments and procurements that we need to conduct. Our vendor management team continues to work. We're talking a 2-person vendor management team under Andrew's leadership, and we're conducting very complex benefit procurements with a lot at stake for our members to get it right. Our communications and government affairs teams just working at extremely high levels. So I think we want to, number one, just praise and acknowledge and celebrate what is oftentimes just heroic work on the part of the staff. But I do also want to note that we're entering into some danger zones of burning people out, and we're going to need to address that as an organization. So more to come on that, but really this is a celebration of the team for making routine or making what looks routine it something that is very much not routine. So I just want to celebrate all of that. Thank you.
Yeah, thanks, Matt. Anna, if you want to go ahead, you have the floor.
I just had a question sort of on that. The call volume in particular in April was really, really high, Paul noted. How many staff do you have answering those calls?
About 25.
Okay, great, thanks.
All right. I know, Bobby, you had a question earlier, so if you'd like, you can have the floor. Bobby, I think you're on mute.
I am on mute. Yeah, I couldn't get back. Yes, I was curious about how many, I'm astounded, first of all, the statistics. It's amazing that with such a small staff that so many questions have been answered through various methods. However, it's amazing to me. It's tremendous work that's being accomplished, and again, kudos to everyone. I had a question, unless I missed it. I'm curious if the calls or how many calls may have come in regarding VITA and specifically GLP-1s. Is that bundled into some other sort of slot regarding either calls or chats? I'm curious whether and how many were related or if they reflected elsewhere.
I think if you want to go back on some of the slides to the phone, it looks, I would say they fall under the category. I can go back a couple more. Phone call dispositions. It could either fall, Bobby, under benefit questions, health plans, or even verification of benefits. We don't have a specific category for VITA, but members that call in, they may have questions about pharmacy, They want to know about the VITA. They also may have other questions about open enrollment. So it's kind of hard because some people call in with many, many questions, but
Right.
they would probably fall in the category of the benefit questions on health plans and verification of benefits. So
Okay.
it's a good list. You know, we don't break it out into every type of phone call because we want
Right.
staff to have the ability to quantify the phone call within reason versus, you know, you could have a list of 20 or 30 types of phone calls, and we want to generalize so that we can at least capture where people are calling in.
Oh, thank you. The you know, the distribution is really like terrific. I also just want to pass on, I have, you know, received multiple compliments regarding your retirement unit and the questions. People who are planning to retire, who have contacted the retirement unit, have nothing but praise for anyone who responds. I just wanted to, you know, let you know that that people are greatly impressed with the information, with the guidance, with help from the retirement unit. So thank you again for, you know, leading that group because they are outstanding.
Yeah.
Thanks. I will be sure to pass that along too to the staff.
Yeah. And I want to say something similar, Bobby, and to Paul and to our staff and to the commission. The degree of benefit support that the agency, that the GIC provides to people who are moving from, you know, age 64 and whatever to 65, and there's probably a lot of people who are planning way ahead of that, is quite a benefit that, you know, I think is hard to replicate in the private sector and in many other places. It's such a confusing time. And so, you know, I feel very proud of the work that the GIC does to transition our constituents into that. And I just don't want that to be overlooked, you know, with those of you who support labor or municipalities or as a differentiator for us. It really is something I hope we continue to be as strong as possible in, because I do think it's needed, you know, even more than ever before. So, you know, in print, or, you know, we probably don't even do print, but on the website and at different times, I think that is something that I think could only grow or at least stay strong. So I'm going to switch gears a little bit. It might be a little bit unpopular, but to the staff, I'd like to ask, you know, is there any innovation and ideas for agentic AI? And before, you know, you roll your eyes or say no, you know, there's really good AI out in the marketplace. And maybe it's for things like Cobra. It's got to be the same answer over and over again. It's repeatable and, you know, it's easy. You know, or even if someone's requesting a form so that your team, Paul, and staff aren't, you know, doing mindless things, and they can be available for retirement or survivor benefits to, you know, to offer, you know, that grief that, you know, people who are experiencing, you know, just terrible things, you know, that you've got the human touch. But I'm also told that AI can do really good empathy. But I'm just curious. I know when we went to the technology many, many years ago, Paul, you know, there was probably some intrepidation, but just curious, anyone thinking about agentic AI to help with, you know, the workload or the quality or cost containment?
Yes, for sure. And I would, if Paul or Stephanie or
Paul?
others have anything to add here, I would just I would just acknowledge the work of Stephanie Sutliff, who's our IT lead with the A&F team, and her entire team. That we've actually done some proof of concept work for AI to improve our internal processes with document recognition and other areas. So we've already started to learn and take some lessons learned from some of that kind of testing and probing. There's also through the broader ANF IT team, not just our 9 colleagues that serve us. They've developed an AI sandbox where there is excellent collaboration between different agencies who are exploring AI for similar functions. So I expect that will continue to point us in the direction of areas where we can make the most use of AI. Whenever we talk about AI, I also don't want to miss the opportunity to just say that we need to be careful in how we leverage AI. There are some areas where it can bring a great deal of benefit, but the potential unintended consequences of leveraging AI is something that we all need to be very aware of, particularly when we're talking about health benefits. There is always going to be the need for a human touch and human intervention on anything that relates to health benefits. So I'm optimistic. I'm impressed by the governor's commitment to leveraging AI and really making Massachusetts a hub and leading innovator in the use of AI, in particular in state government. So I think there's a lot of opportunity here, in summary.
All right. Thank you. And I don't see any other questions, so we can keep moving. Thanks. Thanks, Paul. Thanks, Leslie. I don't know if you heard that. I put myself on mute, but both of your presentations were much appreciated.
Thank you all. Thank you, Madam Chair. So I guess at this point, I will hand it over to Andrew Stern to review some of the basics of our governance. Andrew.
Thank you, Matt. As Matt indicated at the outset of the meeting, over the past year, the chair, along with several commissioners, have suggested that we revisit board governance and the commission's bylaws. We haven't had an opportunity to do so. So today I want to provide a brief overview of board governance principles and the commission's bylaws. About 7 years ago, we devoted 3 commission meetings to governance-related topics. Those sessions included presentations by the Attorney General's Office on open meeting law, the Operational Services Division on procurement requirements, and the Office of Inspector General on board governance. Can we go to the next slide, please? This slide summarizes the key points from the Inspector General's presentation. While it applies broadly to state and municipal boards, the principles are directly relevant to the Commission as well. The first principle, fiduciary responsibility, speaks to our core mission and our obligation to provide high-quality, affordable benefits to our members. The second is ethics. This aligns with the annual conflict of interest training you complete and reminds us that we must always act in the best interest of the Commission, regardless of any personal interests that may be affected by our decisions. And the third is impartiality. Commissioners may advocate for the interests of their constituencies during discussions and debate, but when it comes time to vote, the Commission's mission must come first. Ultimately, these principles all point to the same goal, acting in good faith and making the best decisions possible with the authority and responsibilities entrusted to the Commission. Next slide, please. To understand the Commission's mission and authority, we begin with the enabling statute, which is Mass General Law, Chapter 32A. By my last count, Chapter 32A contains approximately 74 separate provisions, including 38 that are coverage mandates. Today, we're going to focus primarily on 3 sections. Section 1, which establishes the purpose of the commission. Section 2 defines who is eligible for coverage. And Section 3 formally creates the commission and outlines its powers. Next slide, please. I'm not going to read these to you, but I just want to note that from time to time, we receive requests to offer benefits beyond those authorized by Chapter 32A. Examples might include pet insurance or commuter benefits. And while those may be worthwhile programs, the Commission may only provide benefits that the legislature has expressly authorized or has implicitly authorized through statute. I'm not going to walk through the eligibility provisions in Section 2, but it's important to recognize that Section 2 both defines who we must cover and establish the limits of who we may cover. Let's go to the next slide, please. Section 3 creates the commission. While the GIC is located within the Executive Office for Administration and Finance for budgeting purposes, it is not subject to A&F's direction in carrying out its statutory mission. This is why the commission is often described as a quasi-independent agency. As you know, the commission currently consists of 17 members appointed by the governor, representing labor, management, public members, and a health economist. The statute also imposes certain requirements regarding commission membership. For example, no more than 55% of commissioners may belong to the same political party, and commissioners may not be insurance brokers, insurance agents, or employees of insurance companies. Unlike many independent or quasi-independent agencies, Chapter 32A does not establish the position of the executive director. Instead, the commission itself determines whether to appoint an executive director, which is why our executive director reports directly and exclusively to the commission. The statute is also silent on the selection of a chair or even the existence of a chair position. However, it does authorize the commission to adopt its own rules and regulations. Next slide, please. And speaking of regulations, prior to the Weld administration, the GIC operated under a fairly extensive set of regulations that included both operational and procedural guidance for the commission. These were all eliminated as part of the Commonwealth's regulatory reform efforts, and for many years, the commission operated without codified procedural rules. As some of the commissioners present today will recall, that we established a subcommittee in 2018 to draft bylaws, and those bylaws were approved and adopted by the commission in June 2019. In developing them, the commissioners drew upon former GIC regulations, as well as the bylaws and governance practices of other independent agencies. Next slide, please. The commission's primary statutory authority is the power to contract for the benefits authorized by 32A. That authority includes determining procurement outcomes and approving and executing contracts with benefit providers. Next slide. If I go through these too fast, you can't read them, let me know. The commission also exercises authority over the expenditure of trust funds for the benefit of the members. This includes, and determining the extent of benefits includes approving plan designs, determining which vendors and carriers we contract with, and deciding the types of benefit arrangements and contracts the commission will maintain. Next slide. Lastly, the commission serves as the final decision maker in eligibility disputes that arise under Chapter 32A or under 32B, which is applicable for our municipal members. Next slide. As I mentioned earlier, Chapter 32A provides no guidance regarding a chair or vice chair, so the commission's bylaws address both these positions. Under the bylaws, the chair and vice chair are elected by a majority of the commission to serve 3-year terms. The 3-year term was intentionally designed to align with the standard 3-year appointment term for commissioners. The bylaws also provide that the chair or vice chair may be removed before the end of a term, may be re-elected, and remain in office after the expiration of a term until a successor is formally elected. Next slide. The bylaws do not specify a detailed procedure for electing a chair or vice chair. To develop a recommended process, we reviewed the Commission's historical practices, prior regulations, and Robert's Rules of Order. Although secret ballots were used in the past and offer advantages, they are no longer permissible under open meeting law requirements. In the remote meeting environment we are now in, voice votes remain the most practical and legally compliant option. The recommended election procedure is summarized here, and just requires a vote to take nominations, to close the nomination process, and then a vote to pick the chairperson. And with that, I'm happy to take questions or comments.
Are you going to go over like anything on procurement or governance, or is this more just to summarize our, the chapter that specifies how the GIC is formed?
I think that this was a high-level review. I think if we want to delve into particular topical areas such as procurements or open meeting law, we need to dedicate more time than we have today to do so.
Okay.
I'm happy to do that, as you and I have discussed.
Yes.
When we have the bandwidth to do so.
And do it in, with enough time before we do have a procurement. So we have the PBM procurement coming up. I mean, I know we have a little bit of time, and then, the medical benefits will follow there, soon thereafter. So to the degree that you can take this amount of time at an upcoming meeting to go over, if you go to that very first slide on our obligations as commissioners, I think that the procurement laws would be helpful for us to be as focused on our duties and obligation as commissioners. So if you could just flip to that first slide, whoever's running the slide deck, please. So the role of a commissioner, I think we all know our fiduciary responsibility, balancing what our constituents need with, the costs that are incurred, as much as you can balance that. And then, obviously we're ethical in our delivery of what we do on the commission here, impartial and in good faith. I think from a procurement perspective, the laws that the state has put forth, none of us are experts in that. I love how Andrew can quote the GL section laws and the number of things. So there's something like that for procurement, right? And you'll do that.
There is a whole body of laws that and regulations run by the Operational Services Division that we have to follow.
Yeah, so I would love for that at a meeting that you can find time for it so that we can uphold these 4 pillars that I know we're all committed to.
Be happy to do so.
Yeah, but I always love getting a review of this. I remember when we served on the committee, I was fascinated. You even had the year that it was, the law was put into place. It's been a long time.
Been a long time.
So, all right. I don't see any questions. I might be the only one who's fascinated by this, but thank you, Andrew. And then we can move on because no one's asking questions. So thank you. Appreciate this. This is probably a lot of work to pull together at a busy time.
Thank you, Madam Chair. Yep.
Let's do some wrapping.
So we can move to other business and adjournment. And I'd like to ask the Chair's forbearance while I raise some news for the commission under new business. It is with deep gratitude and a little bit of sadness today that I share the news that this annual enrollment presentation that Paul Murphy presented to us today is his last presentation to the commission as he prepares for a well-earned retirement at the end of this month. So allow me to say just a couple words. Paul's dedicated 43 years of service to the Group Insurance Commission and to the Commonwealth. He's been present for every single annual enrollment at the GIC and has played a critical role in the growth and evolution of this agency. He's seen executive directors like me come and go over the years. So Paul began his career here in the audit unit. I think his first job out of college, if I'm not mistaken. And he quickly distinguished himself through his commitment to the GIC's mission and his quickly growing and deep understanding of the work that we do. Over the years, he rose up through the operations division, becoming one of this agency's most trusted leaders and stewards. Few people have had a greater impact on the modernization of the GIC. We've touched on the fruits of all of that work today. When he joined the agency, enrollment and member information were managed entirely on paper. Staff manually processed identification cards, literally typing member ID cards on a typewriter, and actually on a typewriter, writing up reimbursement checks. He's been instrumental in the development and implementation of MAGIC, our enrollment eligibility and billing system that remains the backbone of our operations today. And more recently, of course, he helped lead the creation of My GIC Link, providing members with a modern online portal to manage benefits and advancing the agency's efforts to improve our service, accessibility, and efficiency. Beyond these accomplishments, Paul has long been the heart of the operations unit here. He's known for his extraordinarily deep knowledge, his steady leadership and management of his team, his genuine and real compassion for his colleagues and for our members. I know many examples of him spending over an hour on the phone with a member with a particularly complex issue. So his guidance has his leadership really has helped to shape all of our systems and has been a really critical part of the culture of this agency, which is service to our members. So while Paul's retirement marks the end of an era at the GIC, we are deeply happy for him as he begins this next chapter. No one deserves a delightful and long retirement more than Paul. So on Paul, on behalf of the commission and everyone who works and lives this work and has been touched by your service, we thank you and we wish you all the best in retirement. Just say one more word, which is kind of what's next. So while Paul leaves very big shoes to fill, we're not going to miss a beat as an organization, as Donna Wortman, our Assistant Director of Operations, has agreed to step in as interim Operations Director during this period. Donna has been in her role since 2009. The phrase Paul and Donna is often referred to as one word at the GIC. They've worked so closely together for so long, and we are deeply grateful for Donna stepping in to this role so that we can just provide stability, consistency for our members and staff. So please join me in wishing Paul well. and thanking Donna for stepping into this role.
And that sounds great. Thank you. Eileen, I see you have your hand up, so go ahead,
Yeah.
take the floor.
I just wanted to say congratulations, well-deserved retirement, Paul. And honestly, you have been a very dedicated and really exemplary public servant. And I know sometimes state workers get a bad rap, but I think it's clear that you were dedicated for many years. And I just want to acknowledge that publicly and wish you the best.
Thank you.
So nicely said, Eileen. Go ahead, Bobby.
No, I just want to, first of all, wish Paul like a wonderful retirement and many, many years of it. You've been, I don't know what to say, Paul. I've worked like with him. I've relied on his guidance and his advice for more years than I care to mention. I've known Paul a really long time, and we'll miss that. But I wish you the best. You have been just an incredible public servant. You have just done amazing work with the GIC, and watched it grow over the years under your direction, and cannot thank you enough from the bottom of my heart for all the assistance you've provided to me sort of every time I call or email you. You have been just astounding, and I will miss that a great deal, but I have learned so much from you over the years. Thank you very much.
Thank you, Bobby.
That was very nicely said. So Paul, I want to wish you the best. I also might make you laugh and smile a little bit. When I first met you in 1999, and we did the Boston Heart Party together for many, many years, but that was the first year. And I was astounded at was it 18 different health fairs, and you rented a van and you went all over the state. I thought that was pretty cool and eye-opening for me. I learned so much as well. So a lot of laughs, a lot of fun, a lot of evolution and transformation. So it's nice to be able to look back and see the fruits of your labor. And like Bobby and Eileen said, the service that you've provided to our members is the most heartwarming. And I think I might have even said it to you once at a GIC meeting where I said, I'm really impressed with all that you do for the members. I don't know what my opinion of state workers was before, but I think that the level of dedication is beyond what I ever expected. So thank you for the role model behavior and the support that you provided. And we're going to miss you, but we're also super happy for you to begin a new chapter at such a young age. So there's more to come, I'm sure.
I like the young age. Thank you. But it's been a long journey. I, first of all, want to thank the commission and all the other commissioners that have come through in the 43 years at the GIC for all of their support to me and the operations division. It has meant a lot. Also to Matt, thank you for your excellent leadership skills and to putting the trust in me to run the operations division. That really should be noted, and I appreciate all of that trust over the years. And for the 6 prior executive directors for you, there have been 7 executive directors. But more importantly, I also want to acknowledge my staff. They work tirelessly every single day, processing, answering the phone calls. It is tough work. There are tough days, but I know they are a major, and I say major, success to this agency. What they do every single day is remarkable, and I truly appreciate everything they do. And they have made this agency the success that it is today. And that shouldn't go unnoticed. To Stephanie and her IT team, they are a great team. I will say that thank you for tolerating me over the years with all of the suggestions and system improvements that they've listened to and probably rolled their eyes or went off and said many things, but they did bring all of those ideas to fruition for both helping staff and really to help our members. This workplace has been more than a job to me. It has been actually my second family since the start at GIC. It is a tremendous working group in this agency. They work hard. We are small and mighty, but when I started at the GIC right out of college, as Matt said, with a full head of hair, I will note that, but I developed a passion to look at how the agency operated, what we do, how we could improve it, and how we can go out and meet the members in starting the health fairs in 1986. So it became a passion to learn more, help staff automate a lot of the processes, and help our members. I think the agency has come a long way. And the launch of the portal was a tremendous milestone for this agency. And, it can be taken to many more levels, but I am grateful for everything and all the support from everyone over the years. And I just want to say thank you. I told Matt that I will be here to help with any transition. I leave you in good hands with Donna. She knows everything that I know. So you will be good.
All right, well, thank you, Paul, and we wish you the best, and we know the best is yet to come, but it's nice to hear it's been a family, so I think many people share that with you. All right, at this point, I don't see any other business. Matt?
No, just to remind folks on the commission that there are no July or August meetings scheduled, and our next meeting will be on September the 17th.
All right, great. Thank you for that reminder. So you all have the summer off. Enjoy it. I do want to note that both Catherine West and Dean Robinson popped in after I had a chance to announce who was on the meeting. So welcome. We're glad that you came. Andrew, I see you have your hand up.
Thank you, Chair. I just want to remind commissioners there's 2 new contracts that are in the signature process at this moment, the Mercer contract and I believe the FSA contracts, which you should expect to see a signature page being sent through Adobe Sign with probably before the end of this week or early next week, and to please attend to it once it arrives. Thank you.
Okay. All right. Nope. Thanks for that reminder. So not seeing any more hands up. I have no other business, so enjoy the summer. At this point, I'm going to ask for unanimous consent. So we'll try a new way to adjourn, and we'll do this moving forward. If there is anybody who is objecting to adjourning this meeting, please let me know. Hearing no objections, we are officially adjourned, and we'll see you in September.